who is Heather Demorest, and Heather did her APE with Dr. Peter Bulger, who is an infectious disease specialist at Bozeman Health. And that was the site of her practicum as well. And the name of her presentation is Syphilis Provider Education to Improve Health Outcomes. So I'll let you take it away, Heather.
Great, thank you so much. Can everybody see my slides? Hopefully.
Yes, perfect. Yep,
okay,
they look
great. All right, so thank you so much for joining today, everybody. My name is Heather Demorest. I currently work as a communicable disease specialist at the Gallatin County Health Department, and my site mentor was Dr. Peter Bulger, an infectious disease doctor up at Bozeman Health, and our project was a syphilis provider education to improve health outcomes. So to give a little context as to why we decided to do this project, it's largely depicted by the graph on the right. As you guys can see, syphilis rates in 2022 were similar to what we saw back in the 1940s, which is of course extremely alarming. And accordingly, the state health department issued a statewide call to action back in December of 2022, highlighting that current syphilis trends in Montana warrant immediate attention from the medical and public health communities. And more locally, Peter and I work together quite often in our current roles, and we noticed that there was an opportunity to improve provider knowledge and to develop local resources so that providers could promptly and accurately identify and diagnose syphilis cases and treat them in the clinical setting. So just to show some of the data that we compiled for this training and also to highlight some disparities in the state of Montana, as you guys can see, we do see significant disparities. So most of our syphilis cases in Montana are among American Indian, Alaska Native individuals. And the other thing I wanted to quickly highlight on this slide is in Montana, we do see quite a few females of childbearing age being diagnosed with syphilis. And the reason why this is particularly concerning is the worst possible outcome of syphilis is what's called congenital syphilis, which is, to put it very simply, when a baby is born with syphilis and they contract it from their mother. It's considered a sentinel health event, meaning that it's entirely preventable, but it results in extremely severe outcomes, such as infant death or syphilitic stillbirth. So it's the number one thing we want to avoid with syphilis cases, and that's why it's particularly alarming that we see it in so many women of childbearing age. And Montana ranks 15th in the nation for our syphilis rate, our congenital syphilis rates. So that's really concerning. And just to show you guys how we differ locally in Gallatin County, most of our cases are among white males who identify as men who have sex with men. However, in recent years, we have seen an increase in females being diagnosed with syphilis locally in Gallatin County, which again is concerning for congenital syphilis. So we had 3 products from this provider training. It included a presentation, a one-page quick reference guide, and a knowledge assessment. I'll get into the quick reference guide and knowledge assessment a little bit later. But to focus on the presentation, we delivered it at Bozeman Health, and we chose Bozeman Health as our site for a couple of reasons. One, of course, Peter works there, so it was easy to get in with Bozeman Health. And then also, it is our largest health entity in Gallatin County, so it made sense to start there. And we also chose our audience as the internal medicine team. The reason why we chose the internal med team is it's a pretty large group of providers, and they are also likely to see a wide variety of patients and their specialty is not infectious disease. So we wanted to make sure that they were familiar with syphilis, especially in light of the increased rates we've seen in recent years. And we also delivered our training at a pre-existing meeting. Provider schedules proved to be a barrier for us, so it made the most sense to utilize a meeting that was already taking place. So to give an overview of our presentation, Peter and I did kind of a hybrid presentation. So my part of the presentation focused on the background and epidemiologic significance, which we showed you guys a little bit of. And then that included a synthesis of national, state, and local data with a focus on disparities. We also focused on the differentiation between the public health's role and the provider's role, and how we can work together to not only identify and treat syphilis cases, but also quickly identify sexual partners and treat them accordingly. And then Peter's part of the presentation was the provider education piece, which I think worked really well to have that peer-to-peer education. And it focused on screening, staging, treatment, and treatment indicators. I'll just quickly say that syphilis is an extremely complicated illness. And so it's a difficult one. It's one that a lot of providers struggle with. So that was a lot of information to cover. And then we wrapped up our presentation with some best practices and also sharing resources, which included continuing education opportunities for providers if they wanted to continue to learn more about syphilis. We also developed a quick reference guide. So in one of Peter and I's first meetings, I asked him, what would be really useful for providers to have in a clinical setting? And he suggested just a one-page document that they could quickly reference. So we developed that, and this is what it looks like. And it has a lot of information on it, but again, syphilis is a very complicated condition. So we wanted to make sure that providers would have all of the information necessary to not only identify syphilis cases, but to treat accordingly, and also to continue with post-treatment monitoring and when they would know whether or not treatment was successful. And then we also made sure that providers had a local testing algorithm. It can vary depending on the testing site. However, this is what we typically see in the state of Montana. So we wanted to make sure that the providers had that. And then we also included some key considerations and reporting information because syphilis is a reportable condition in the state of Montana. So we wanted to make sure that providers were familiar and comfortable with how to report to public health. And the final piece was the provider knowledge assessment. So we developed this assessment with just 10 questions. I made sure to closely collaborate with Peter on this to make sure that the questions were provider specific and also a provider difficulty level. And according to the providers who took the knowledge assessment, it was a very difficult test. So we delivered the pre and post test via a link, which was sent out over email 24 hours prior to the presentation and 24 hours after the presentation. And some limitations to this was that unfortunately only 10 out of the 25 providers completed both the pre and post test. And there was some variation in when the test was taken. So it ranged from within an hour after receiving the link up to 120 hours after receiving the link, which may have skewed our results a little bit. However, the results were overwhelmingly positive. We saw significant improvement from the pre to post test. So the graph on the left depicts by participant, the pre-test is in lighter green, the post-test is in darker green. And looking at the overall comparison, you can see, again, that significant improvement. The lowest score on the pre-test was 10%, on the post-test was 70%. The highest score on the post-test was 90% versus the pre-test at only 40%. And the average on the post-test was 83% compared with an average of 29% on the pre-test. So again, significant knowledge improvement. And we also received some really great feedback from providers. The receptivity was awesome, and it was a really good thing to see. A lot of providers were really excited to learn this information, and they thought it was valuable for them and their practice. So for next steps, we do plan to continue to deliver this training to providers, and we are going to adapt the training as applicable based on our audience. So for example, if we're delivering the training to providers who see a lot of pregnant patients, we're going to have more of a focus on congenital syphilis. And we have already distributed the one-page quick reference guide to all local providers and clinics. So for foundational competencies and products, I'm not going to read through all of these. A lot of it was focused on data collection and also just communication strategies. So to start with the foundational competencies, we were able to select quantitative and qualitative data collection through the pre and post knowledge assessment and analysis, and then communicating audience appropriate content. Of course, we made sure everything was provider specific. And then with the concentration specific competencies, it was all about gathering data for rural and frontier settings and also identifying common demographic characteristics, which was really utilized in our presentation. So some barriers that we ran into: provider schedules, again, definitely proved to be a significant barrier for us. It's difficult to get a group of busy people together, and it worked out really well for us to utilize a meeting that was already planned and to be able to provide the training at that point. And that's probably the model that we'll continue to use moving forward. And then for both Peter and I, we had an unplanned busy work schedule. We had some staffing changes and we had difficulty meeting in person on a regular basis, but we were able to still talk to each other remotely and accomplish all of our objectives. And then it was a pretty small group of providers. We only reached 25 providers through the initial training. However, again, we do plan to continue to deliver this training and to reach more providers in our community. And then some surprises, I was, again, really pleasantly surprised by the receptivity of the providers. They were really excited to receive this training and had a lot of great questions. And then seeing that knowledge improvement from the pre to post test was really encouraging. And yeah, it was a great surprise to see that much improvement. So that is everything for me. Thank you everyone for attending today, and I'm happy to take any questions.
Great. Thanks, Heather. Awesome, everybody. So I